Okay, welcome to the 8th lecture on collective intelligence in organizations. This lecture will go deeper into um, what actually creates a team. Um, and we'll look at how representation and discretionary behavior are the things that sort of make a team into a system. Um, if you start thinking about what does collaboration really look like, we can use this as an example. If you think about a football team who's sort of playing at a high level, you'll understand that, well, it's all a lot of individual skill, right, to begin with. But when they play, they sort of coordinate a lot of things at the same time. Coordinate their skills in playing the ball, but also in being aware where the other players are, their own players, the opponents, where they are on the field, and they try to foresee what's going to happen and so on. They're very active, they're very into the situation. And this is, of course, a skill that they develop as they practice and play through the years, from being junior players into senior players and so on. So it's a lot about skills in football, you could say. But there are also a lot of other things that enables them to play at this level that maybe we don't tend to remember. And it's very basic stuff. It's the ability to see, the field. They know within these white lines they're supposed to play, and they can't play outside that. They can see the goals where they're supposed to score. They have a referee who's even got this pipe they blow in if they want the game to stop. They can see whether the ball that they're passing is actually reaching their where it's intended to go, and so on. So all these conditions for coordinating is there. But now, if you think about coordinating this instead, well, here's a group of people who are supposed to discuss something, complex, and come up with a good solution. How do they, even if they're very skilled and have the right education and training and everything, how do they know in that room at that point in time that what they're saying is really a good pass or not? How do they know whether they are have a good team play and are achieving things or not? It's not that easy in that environment, since we can't really see what we're coordinating. So here's just some examples. In the football case, you have this clear goal, you can see the players, you can see the result, and you can actually see skill. It's easy to see whether someone is skillful. Even if you don't score a goal, you can see that, yeah, that team is playing well, but maybe they're unlucky and so on. But in this other environment, you have a lot of different objectives that are relevant at the same time. You don't really know who knows what and who you should be listening to. You don't really see that easily what leads to what. Some of the things you're talking about and making decisions on aren't obvious what they really result in, maybe until years after the meeting. You don't know much about the involved and their skills and so on, and your own actions. Did I help or did I hinder? So basically, you could say this is our thesis in this whole theory and book, that we need to start understanding what cooperation looks like, and maybe share a model on the meta theory of how to cooperate, so that we can discuss the play in a sense. And if we want to do that, we could start analyzing what it's really what the things are that really needs to happen when you work efficiently in a team. This is a bit theoretical, but still it's a starting point. Now, to begin with, if you have an understanding of something you're supposed to work with, we call that a representation. It's a mix of things that you know and have experienced and learned through the years, but it's also situational things that you have your emotions in relation to this thing, and you have expectations, and you are more or less present, you have different priorities, and all these things comes together into a certain like a picture of the situation. And this could of course be developed or undeveloped. Developed, maybe you thought things through a lot, you've been thinking about it, and you've been sort of looking at different perspectives. If it's undeveloped, maybe you're just unprepared or you're not interested and so on. But you can understand that you can have a more or less developed individual representation of a situation. Now the next step is of course to join this between a number of people, and then we have some theoretical extremes. Suppose you have, like the second picture shows, you have 4 people who have fairly developed representations, but they're totally different. There is no overlap. That would mean that in theory they have access to a lot of knowledge in relation to the situation, but they don't have any possibility to communicate this to each other because they don't share any parts. So whatever someone says, it's like having different languages, talking different languages. So there's no basis for coordination. The other extreme, of course, is then that theoretically everybody had exactly the same representation. That, of course, would mean that they immediately understand each other and what you're referring and talking about and so on. But on the other hand, it doesn't add any value, because you could literally take just one of those 4 persons and you would have access to the same understandings of the situation. So a theoretical optimum then is, of course, to have as different representations as possible, but enough overlap to ensure that these people can actually communicate with each other and, at least in their process, start to understand each other. Now, if we assume, as you already know, that reality is something infinitely complex, that we can't really grasp everything in a situation, then the challenge must be, of course, for a group to create the highest possible level of potential intelligence would be to have as a developed representation as possible. That would mean that they have access to as many possible perspectives and understandings of the situation as they can have. So it's like the left side of the picture. That's also why you say that the highest level of intelligence is basically the one that borders to chaos. Since we can't understand everything, the next step, if you sort of add additional knowledge to this developed representation, it would fall apart in being over complex for the group or for the person. So there somewhere is the maximum potential for intelligence. And then you can look at the other part, the other side of it, and see that if you have the other situation where you have a lot of individuals having their own understanding of the situation, and they have this more narrow perspective, it also means that the likelihood for them to misunderstand each other increase. If you have a narrow representation, the chances that you hit exactly the same spot that someone else in the team or close to someone else in the team, well, it becomes lower if it's sort of narrow. Okay, so let's take an example, because maybe this is a bit abstract. So what could this look like in reality? I'm going to use an example here with it's actually a real an example from our research, so it's a real thing. We have a situation here where we have two doctors. They're both surgeons, they're both highly specialists, and they're both senior at their workplace. And now the situation is that there's this patient with a fairly unusual need of surgery, which to specialists in this area is of course an important situation, because it means an opportunity to do surgery on a patient which is unusual, and it's a chance for them to develop their understanding of their skill and so on and so on. So to these doctors who work with this on a daily basis, they don't just see the patient situation, they see a work situation as well, work opportunity, a learning opportunity, and they're aware of this. So they sort of in a sense you could say enviously watch out for this situation, because it means that they have this chance for doing this surgery. So their first thought here in this situation is that the one doctor thinks that, okay, now doc number two here is going to want to do this surgery, and he's going to, try to maneuver to get the surgery, to get to do the surgery. And doc two, he's aware of this, and he's thinking, oh, she doesn't want me to do this. Maybe she wants someone else to do it, or she wants to do it herself. So I'm gonna have to ensure that I'm the one who gets to do it. Now that's sort of the starting position, but you can't talk like that. That wouldn't be, that's not socially accepted. So instead of discussing this, they would say things like this. Doc 1 is going to start to argue that maybe we shouldn't be doing this surgery at all, because it's very expensive, we're not sure of the outcome, there could be alternative treatments, and so on and so on. But then Doc 2 here has a very powerful argument, and he starts talking about, but surely this patient's health comes first, and we need to give this patient this opportunity of becoming well if we do this and it succeeds. So this sort of is without discussion. And if we look closer to this, what's actually happened here from a problem setting point of view is that Doc 1 is implying that this is a cost issue. This is budget. This is something we need to consider from an economical perspective. But Doc 2 has a totally different problem setting, arguing that this is, it's a moral issue. We're doctors, we're taking an oath, we're supposed to just act for our patients and do the best and so on. So here they are locked down in this situation. And now we could ask ourselves, okay, so who has the right view? Who's got the right perspective? And how do you create collective intelligence from this? Well, in order to think about that, we need to back out and see what's the situation here. Well, you could maybe define it as a patient possibly in need of surgery. That's sort of our utmost frame. But within that frame, you have now a lot of things to consider. That's relevant. You have costs, of course. This is a cost issue, and hospitals have a budget and so on. But it's also surgical issues. There are moral issues. There's patient health. It's the timing for the patient. It's possible outcomes, alternative treatments. Is the diagnosis right from the start? What's the contingency here if something goes wrong? How should we consider that? And so on and so on. As you can see, there are lots of different things. This is what we mean by it's impossible to capture every aspect of a situation. There are so many different things that could be considered here, and we can't grasp them all. And what's happening in this case, where we have a sort of a negative spiral between these two persons starting up, is that if they should have a chance to discuss this from a sort of joint intellectual point of view, they would have to have a background where they have captured a lot of these different aspects together and made them sort of legitimate to discuss. And if they had a good relationship, working relationship before this incident, then they would have been talking about a lot of different things. But now instead, they're sort of locking into just, in a sense, two aspects of the situation. And these can never meet, since you can't argue with moral in relation to costs and costs in relation to moral, because they're sort of not meeting each other here. And if you think about this downward spiral, what could happen here is that Doc 1 after this incident starts disliking Doc 2 and thinking that he's always, making it easy for himself, talking about morals here. I'm the only one who's considering costs and reality, and he's an irresponsible person. At the same time, Doc 2 could start forming an opinion about Doc 1 that's the opposite, that she's always, she's not a real surgeon who takes consider the patients at the first, but starts talking about bureaucracy, administrative issues, costs, and things like that. And now, if we're unlucky here, they could sort of be locked into these perspectives of each other, meaning that the next time they meet in similar situations, they would be triggering these thoughts about each other, meaning that already from the beginning they will have opinions, making them listening to each other in a special way. That would sort of make it much more difficult for them to actually have an intelligent discussion on the situation. So that was the first part. Thank you.